Hey guys, I'm super excited to be here. We're going to be talking about the Chrome device, which is one of the newer devices from Cartessa's, amazing platform of technology. And just to tell you a little bit about myself, my name is Adarsh Mudgil. I'm a dermatologist based in New York City. I started my practice there about 12 or 13 years ago, and I have a satellite office out in Long Island, which is where I'm located right now. I introduced so being in New York City, I needed a multi-platform device because the spaces are so damn small there, and I had a Cynosure icon. It was a Palomar icon, the Cynosure icon for a while, which is a multi-platform device. Didn't take up a huge footprint, and I had it for a long time and I loved it, but I needed something that was a little bit more powerful. And I recently introduced the Chrome device into both of my offices. So I have two of them. I own two of them. And I was, kind of transitioning away from the Cynosure device, which I was very comfortable with, to the new device, to the Chrome device. And I finally cut off the training wheels and got rid of my old devices, and I'm exclusively using the Chrome device, which has been awesome. I've really been enjoying having like a proper laser in my office, and I'm very excited to have the device, and I'm even more excited to have Dr. Tom Griffin here, who's more of a laser aficionado than I am, and he's going to tell us a little bit about his experience with the device. But first, Tom, why don't you tell us a little bit about who you are, your practice, and we'll take it from there.
Yeah, thank you very much, Dr. McGill. So I'm a dermatologist as well, practicing outside of Philadelphia in a town called Plymouth Meeting. Since graduating residency, I've been in private practice now for about 5 years. And during this time, I've been acquiring a plethora of devices in order to really work to treat everything the skin could possibly be lasered by. Early on, I invested with Cartessa with the Vivace device, now the Virtue. I also have the Cool PLCO2, the Pico Discovery, the Alexandrite Modus. What else? The Denave as well. So I've got a number of different tools from Cartessa, and every single one of them has been terrific. Um, Starting early, I was invited to be part of the medical advisory board, which gives me the opportunity to look at and examine some of the newest technology that Cartess is bringing to the field, play around with it, let them know what I think about it, and really examine the results to make sure that what it is that Cartess is promising we can actually deliver in real life. And so that's how the Chrome came to me. And during that time, I've been working hard to try and get the best out of it.
That's awesome. So how long have you had the Chrome?
Had the Chrome for 8 months now.
Okay, pretty long time.
Yeah.
So I guess we'll just dive right in, man. Let's just get into some of the science, some of the technology. So one of the unique things about the Chrome device are the skin apps, which are
Mhm.
basically stacked or layered treatments. Maybe you could just walk us through. Did you help develop those, or were those already part of the
They
device when
were
you
already
got it?
part of the program when it came to me. They had been extensively studied in Italy, and some of the things that people will tolerate in Italy, as far as recovery goes, and here in the United States may not be so acceptable. So we have had to modify a little bit, but you know, the skin app is a protocol. And when either the Discovery or the Chrome, these beautifully powerful, intricately developed and engineered tools made by Quanta uh, get delivered to the office, there's a ton of hand pieces. There's a bunch of little shape selectors for the beam profile, and it can be quite overwhelming. And so, especially I got the Pico Discovery going on 3 years ago now. And at first I was like, whoa, what is this? How am I going to use this? How am I going to put this into practice? And the skin app really allows for simplification of what can be a very complex tool. And so it gives you a protocol in order to help kind of target and get the best out of the device, for what it has, because you're mixing multiple wavelengths, you're mixing multiple shapes, you're mixing fractionated and full field. So there's so many different things that these tools can do, that if you're not given some semblance of guidance, it can take a really long time to learn. But this really gives us the ability to get results relatively quickly.
Yeah, I think that's a great way to say it. It's funny. I think I told you this when we first met. When I first got the device, I actually had a few patients that for pigment, all I really had was an IPL before I had this device, and I had a few patients where their pigment would lighten, but I just couldn't completely get rid of it. I said, "Don't worry, I'm getting this new device. We're going to take care of this." And I had a patient who was kind of chomping at the bit to come see me. And finally, I said, when I had the device all set up, I was like, "All right, come on down." And this was before anything was like really set up, but I just had the manuals from Quanta. So
Yeah.
I said, "All right, pigment, blah blah blah, 532, whatever the settings were, and I treated my patient, and she sent me a picture like a couple of days later. She's like, "Does this everything look okay?" I was like, "Yeah, it looks great. Everything looks great, But she had this like, crazy reaction, this like just this crusting scabs. I knew she was going to be fine. She ended up sending me 2 bottles of rosé after a few weeks when everything recovered. And she looked great, but I was like, "Oh my god!" And I talked to some of the folks at Cartessa. I was like, "Guys, like I'm on Fifth Avenue, New York City. My patients are not going to be able to have like 3 weeks where they're hiding out." I mean, again, she had an awesome result. But now I started actually diving into more of the settings that are part of the skin apps, and the treatments are much more tolerable for my patients. It's a pretty efficient way to treat your patients as well, because like you said, you get this device with all these hand pieces, and it's like, oh my god, like how am I ever going to have the time to figure this out and sort out this device and know which hand piece to use and the settings and all that stuff. And to
Yeah.
be perfectly honest, like for the first couple of weeks, the first couple of months that I had this device, I actually had my icons still. And I was just leaning on them. And I was like, "Oh, you know what? I know how to use this device. Let me just use this." And it wasn't until my fractional, my 1540 handpiece actually broke on my sinus shore. I was like, "All right, here we go. It's time to fire up the Chrome." And I've actually haven't touched, I actually got rid of both of my other devices finally, but I've been exclusively using the Chrome since then. I've been super, super psyched about it. But
Yeah. I think picosecond Q switch. So this is a Q switch device in the 532 wavelength. Does fundamentally look different when you hit a brown spot with it afterwards versus that normal little pepper grainy that you're going to get from a pulse light. But it's more powerful. And so, just as you said, those low contrast ones, the ones that you almost got gone but you couldn't do, that's where I find the 532 wavelength, which is so highly absorbed by pigmentation, is really, really good. And with that ultra short pulse duration, you don't have to be so worried about burning the skin as you would with like shortening a pulse duration, and you can get a really nice result with it. But they do and can look a little crusty, sometimes even get a little bruisey underneath of it.
yeah. Yeah, well, especially with the deeper fractional, they actually, some of the patients will bleed, which is
Yep.
something which I, didn't see with the 1540. But I guess the audience, I imagine, is pretty sophisticated here. And, most folks probably have devices or, at least use lasers in residency, et cetera.
Mhm.
Maybe you can walk us through just some of the specifics that you're using and how these, like the skin apps, how you're layering treatments.
Yeah, so the devices of 532 and 1064. So, and then you can have erbium on it, and you can put a pulse light on it. So the first thing that I'll do is work to target the browns. So I will pick out individual darker lesions and use a smaller spot size with the 532, and get them to nicely darken. For patients who have a little bit more global dyschromia, I'll then take a larger spot size, the 5 millimeter, and just kind of lightly paint the whole face. And then on top of that, you can either use the 532 in a fractionated version, or you can use a 1064 in a fractionated version in order to get some texture as well as some more pigmentation out of that. So it's a layered approach to kind of target specific browns, more global browns, and then some texture after. And that comes as the refresh. That's essentially what that skin app is.
So
Um,
it
you
starts
know,
with the 532 targeted treatment.
yes, 532 targeted. Get the bigger, deeper ones to kind of darken up. little light global treatment. If you want a patient to have a little bit less downtime, you can use the fractionated handpiece. If you want to be a little bit more aggressive, you can do a full field handpiece. So there's a lot of different ideas, different ways to kind of approach them based on what their needs are, what their expectations are, and what your comfort level is with the tool.
So you're starting out with that adjustable handpiece in 532 Q switch setting, zapping
Yes.
a few spots, the darker spots, and then you're switching to the 9 HC, which is the
No, so then
fractionated.
I'll take that same zoom handpiece and I'll just widen the spot to 5 or 6 millimeters and keep essentially the same fluence, but because you're widening the spot, you're not going to be as aggressive and just kind of painting over the whole thing, and then I'll swap it out to the HC handpiece, which is a handpiece that I absolutely love on this device
Yeah, me
because
too, man.
the density of the fractionated so the device comes with a 9 millimeter and an 8 millimeter fractionated handpiece. The 8 millimeter, the density is a little bit less per spot and it's deeper penetrating. The HC handpiece or high coverage handpiece is 9 millimeters, more dense per spot, and targets much more superficial. And so for those browns that are just actinic damage all over, it's a really nice way to get a fairly high dense injury without adding significant downtime.
Yeah.
It's very, very fast.
You know, it's cool. Actually, I've been using that a ton lately. And what I've been doing is with that handpiece is I actually won't even like target specific lentiginous. I'll just literally just blast it with that handpiece a little, a few more passes with the
Mm-hmm.
9HC, and it really fire. You can do a whole face, and I mean, it's super super quick, which is it's very very efficient device. And I've been having just awesome results, and it's kind of similar to what you would see after an IPL. Like the lentiginous will actually darken, so you know that you've kind of hit that endpoint where he's cooked up the melanin, and I'm confident that the spots are going to go away. Yeah, so I've kind of similar to what you're doing, but I'm just doing more passes with the high coverage
Yep.
for the pigment.
And those macular seborrheic keratoses, the ones that women have all over their arms and their legs, and they cannot stand them, and pulse light absolutely doesn't touch them. They'll darken and
Yeah.
then they come immediately back. It's a nice way to cover a large space relatively quickly. So you can, that's what I'll treat the lower arm with, and then sometimes I'll come over it with a fractionated non-ablative treatment. So you can mix and match this with other tools as well.
Yeah, that's it's funny because with my old device, which just had an IPL handpiece for pigment, I would tell my patients, I can treat your face, I can treat your chest, I can treat your hands. That's it. Because it did nothing for the arms. It just would do, like you said, zap it, nothing would happen, or get darkened and it would come right back. But it's awesome. It's actually opened up a lot more, body parts that I can get rid of the
Yep.
sun damage on. Awesome. So why don't we walk through some of the next the app that you've played around with?
Sure.
So do you do chest? You do the decollete? Have you been using that?
I've done the décolleté, and I think again, patient selection is really important. So people who are really superficial brown, it does very well with. So the décolleté is essentially the same sort of treatment as I described with the refresh, just kind of transitioned into a different area, right? So spot treatment with the 532 to darker places. If you have the pulse light, that would be the first step, and then 532 HC covering the whole area. So that's the 530 HC will get some of that like sort of long-term low level kind of brown that's in the background. And then, your 532 spot's going to pull out the more specific browns.
That's
It's quick, easy, well tolerated, gets a little crusty, like flaky as any kind of pigmentation treatment will get, but I've gotten very nice results with it.
Have you used it on the hands?
Nothing really comes to mind. I probably have. I just don't. It's the hands are like one of those things that I just sort of throw in there because they're
Yeah.
there, and I just kind of do it. It's not something that I generally like scheduling people for. It's kind of like, just a little add-on at the end.
Right. How about vascular stuff? Have you used it for vascular?
Yeah, so the 1064, 1064 is a really deeply penetrating vascular laser. And so one of my patients who will have a before and after later, she had some deeper telangiectasia as well as some kind of spider angiomas in there. And it was a really easy, just kind of toggle over and add it with the Zoom handpiece. So it's very simple. 1064 is something that for bright reds is fine. It works well, but it loves those deeper blue vessels around. So leg veins, etc. It's not something that I've done a ton of with this, but those that I have, it's worked very well.
Yeah, I actually had a patient yesterday that I was doing a basic photofacial on with this device. So I just targeted her vessels first. They used the 532 HC, and she actually said she's like, I had these veins on my legs, which was driving me nuts. She had this one patch that she said she's had since she was a teenager that was just driving her insane. She's like, can you laser? I was like, you know what? I actually can. And it was pretty cool. Like I was actually very impressed. I hate doing sclera. It's something I've always hated doing.
Yep.
Just because it's just tedious and never amazing results. But this was incredible. Literally just blasted the vessels away. Just, they would kind of melt right before your eyes. And it's pretty exciting. Like I'm pretty excited to be able to add that, as something that I hated doing leg veins before, but now I think I'm probably going to really enjoy doing them.
Yeah, I mean, 1064 is a wavelength you have to be a little careful with. It's very deeply penetrating and very, very powerful. So it's something that it takes getting used to, and you have to very, very slowly, methodically do it, especially on the face. But for leg veins, I much prefer to laser than sclero as well. I find sclero to get mixed results. They've got to do compression stockings for a week. If you bleb or miss the vessel, you can cause ulcers and things like this that are around. And the vascular laser does take several goes at it to get complete clearance, but it does very, very well, and it avoids a lot of those extra concerns.
Why don't we dive into some before and afters as we can talk folks through some of your treatment strategies?
So this is a refresh treatment to sort of reiterate the general gist of what this skin app is. It's primarily a 532 Q switch treatment. And 532 is super highly absorbed by pigmentation. So a lighter skin patient with actinic damage and lentigines are its real go-to prime target. This is a nice young lady with some lighter brown where pulse light may not have been super effective. She also has a mix of some light telangiectatic rosacea and some areas with some more dilated blood vessels. And so I did sort of stray out of the normal skin app here in order to get her a more ideal treatment. So I started by targeting some of these areas up on her forehead with the darker ones with the 532 spot 3mm zoom handpiece, and then extended that out more globally with a 5 or 6mm spot size again with the zoom handpiece. You can see the vascular area here, as well as some cherry angiomas that she has up on her forehead, which have disappeared with the 1064 vascular laser. For this one on the eyelid, again, this is one of those types of treatments where if you just left the upper eyelid like this without pulling it up onto the orbit, where bone is underlying, you could put the eye at risk. Fortunately, she had enough laxity to pull that up, and we could safely and effectively treat that. I love this result. You can see not only improvement in the browns, but with the 9mm HC handpiece, you can also see a great textural improvement around her eyes. These
Looks great.
images are taken with the the Vizia camera, so the lighting situation is exactly identical before and after. This in one treatment, a month post, is a very nice result. As you can see from a texture standpoint, as well as vascularity, overall the skin is brighter, cleaner looking. The alternate side, again, similar result in the eyes. So you can see that it's not really it's not a fluke on the one side. Forehead lines have improved, and overall skin is brighter, more evenly textured. So really nice. I mean, for a one treatment without any real major downtime, she did swell a little bit for a few days, but unlike an erbium fractionated ablative or CO2 fractionated ablative, to get that kind of periocular result is really nice.
Let me, if you don't mind, if I could just ask a couple questions.
Shoot.
So your strategy basically is you're targeting the pigment initially, then you went and got with the vascular laser to sap some of the telangiectasias and stuff away. Immediately after you do the fractional laser, like it's all done in one sitting.
Yes, all
And
done
how
in
long?
one sitting. Takes this took me about 20 minutes to do.
And then in terms of like, obviously depending on where you are geographically, like prices are different. But like what does this cost a patient? Is it a one and done? Do you sell them as a package?
So I mean, my role with Cartessa really is to examine and to look at the utility of this device and prove its worth. So for these patients, I'm not functionally charging them, but
Got it.
if I were to charge, it would be in the Philadelphia area, a $700 to $800 treatment.
Got it. Cool. Yeah, it looks great, man. That's impressive just after one treatment. It looks like
Just one treatment.
there were multiple fractional laser treatments there, it's
Yeah, I mean, certainly speaking, with this device and given the amount of kind of wrinkling and aging, normal aging for this patient, using the fractionated erbium on top of this would be great. I think she'd get even better result from a texture standpoint. With this tool, you could certainly bring her back, give her another refresh and add to that if you wanted. It's all right there for you. It just is a matter of your discussion with the patient whether or not they can have a little bit more healing time.
Yeah, that's great.
So this is another refresh. Again, you can sort of see the type of patient that I'm choosing for this. Long-term sun damage, lighter skin patient, and again, very similar sort of process, very similar sort of results. So consistency is really key, is something that we want to look at, right? Brown spot, all of this deeper pigmentation. These aren't like big, bright, dark brown spots that could be, you could breathe on them with pretty much any tool. This is deeper set actinic damage. So to be able to clear that is not the easiest thing with minimal downtime. So again, target the browns, do a light global treatment, target these ones around the eye and pull that back, but you've got a very small spot size, so it's pretty easy to do. And then a light HC treatment over the entire, light fractionated 532 around the entire face. And for one treatment, 1 month post, nobody's going to complain about this. A very nice treatment, improvement in forehead lines. This perioral area really needs a more aggressive ablative resurfacing or ablative fractionated, which she's on my schedule for 2 weeks from now to actually do just that with the erbium here.
Great. Yeah, the pictures almost don't capture like how impressive that result is on the left cheek.
Yeah.
You can see it, but in real life, I bet you it's a lot more remarkable.
Yeah, and she's thrilled. I mean, it's bright, it's glowy. Her skin just looks clean. And one of the better images that the Visio will take is a polarized image, so it's just flat. It doesn't have any reflection, and that image just it pops us even more.
Awesome.
So yeah, you can see it better here.
You actually
But
see the
even, you know
improvement,
what?
the fine lines.
Yeah, again, sorry. Again, even around the lower lid area, I mean, you know, that's for a non-ablative, you know, non-fractionated, you know, nothing that we're targeting water or really trying to resurface to get that improvement, and the quality of the skin is really nice.
Yeah, that's great.
So this is a patient, a young lady who came to me really, really worried about this sort of dull, irritated erythema that she's got. And you know, one of the things that pulse light doesn't do very well, and a big vascular laser 595, 585, or 1064 doesn't do very well at their long pulse durations, is this sort of microvasculature. So I was really excited about this Define app because what it does, it has is more of a laser genesis type setting. So it's a really, really short pulse duration, low energy, many pulses to sort of heat the skin, and with that, that microvasculature sort of melts away. Um, and by itself, it's a very low downtime, easy treatment. All the patients feel is a little bit of heat. So you know, with that, you get some tightening, some pore size reduction, but no downtime. And so for her, her secondary complaint was her pore size and the overall texture of her skin. So, you know, this Define sort of hits it perfect because you've got that Genesis like treatment with the 1064, and then you follow it with a light fractionated erbium. So you're able to get your texture and tightening all sort of in one skin app. And so I was fortunate to do 2 treatments with her, and you know, not only does her skin have a much lighter redness to it, but her acne scarring and pore size is improved.
Yeah,
Uh,
that's much better.
I mean, it's so much smoother, so much brighter. Pore size is much improved, and you know, the fractionated erbium handpiece is really nice. It's very fast. It creates sort of a hexagonal kind of light injury, but you know, with this, she healed up almost entirely in about 3 days. You know, she had a little bit more redness to her skin. Aftercare with it was a little bit of elastin nectar and some moisturizer. So she didn't need big Vaseline, goopy mess. There's no blood with this treatment or anything like that.
So this Define incorporates which 2 hand pieces?
So the Define is a 1064 with the zoom handpiece. So you're using it at a slightly larger spot, and you're using it at a really short pulse duration and low energy, and you're just doing tons and tons and tons of pulses, and you go sort of quadrant by quadrant by quadrant by quadrant. And you know, sort of like when she starts to say that feels really hot or ow, you move to the next area and you just pulse a bunch, and then move from there. So what they're feeling with the ow isn't the laser hit, it's just kind of like the cumulative heat.
Mhm.
And then secondarily, you take the erbium fractionated on like there's a really superficial adapter that goes on top. So you're not targeting like, you know, a deep erbium type injury with blood and other stuff. You're just really hitting. It's almost like a cool peel,
Mhm.
superficial and high density.
Very cool.
But for that, really, really nice result. You know, and so she'll maintain with more of that Genesis like treatment moving forward.
Great.
So those are the before and afters we've included for my patient set here today.
Gotcha. Okay, gotcha. Yeah, awesome, man. Really, really impressive. I actually don't have the erbium handpiece, but maybe now you're making me a little jealous that I don't have one.
Yeah, I mean, it's everybody has color and everybody has some texture, right? So to be able to treat both in the same box is a really nice advantage. It just takes a second or two to change that over, as it does with all the hand pieces. Some hand pieces, like, you've got a detach and you've got this whole big long cord and a whole brand new handpiece. When we're talking about hand pieces, it's a very small, quick change. It takes about 5 seconds max to switch a handpiece out. So it's not a big, huge production. I kind of keep it. I take them all out, put them on my Mayo stand next to me, and just flip them in and out really quickly.
Yeah, which is great. My old device is a long hose and it's hard to like articulate the handpiece into the device. This is really, really easy. We actually got like this super cheap, like $5, like a kitchen partition that and it fits the handpieces perfectly. And you just literally just
Yeah,
swap them out, it's pretty amazing. Yeah. So that's been ease of use is up there. Yeah. This is very easy to use device.
absolutely.
All right. Being in New York City, for me, it's important. I have, like I said earlier, I have very limited space, so I can't have a million devices. With my practice in the burbs, there's a lot more space. It's easier to do, but I like to offer the same procedures in both offices. I do have patients that live in both places and will see me in either office. So when I was looking for a device, it had to be a multifunctional device. I had to be able to treat a bunch of different things with one device because I can't, I have very, very limited footprint space. And one of the limitations I had with the device that I used to use was, like we were discussing, I could never get rid of pigment completely. It was a really dark spot. I was very limited. The handpiece was an IPL, so I'd have to use that for red. I'd have to use that for brown. For vascular stuff, I'd have to use it for pigmented stuff. And there was very limited places I could actually treat patients: face, chest, and hands. So when I was looking to upgrade my device, I wanted something that was similar but more powerful, allow me to offer my patients, hey, I can actually get rid of your lentiginous. I could get rid of that light stuff. I can get rid of the dark stuff. I can get rid of your vessels. I could treat other parts of your body. And having never had a proper laser, so I never had a YAG laser in my practice. It really, it's opened up the doors for me with a device that has a small footprint. But I was nervous about ease of use. I didn't really fire a laser since I was a resident, because in my practice it was an IPL basically, and I had an erbium, which was part of the platform I had. But so when I got this device, I was a little bit hesitant. I was a little bit nervous to is powerful. I was a little bit, the power made me a little bit nervous. So I did kind of lean on the device, on my old device. But now that I've been using this device more, and I'm seeing how easy it is to use, and Synapse are a big part of it. It really kind of dumbs it down. But you can also work out of the boundaries of the Synapse if you want to be a little bit more aggressive. So I think what's great about this device is, if you're looking for an easy to use device that can really treat a bunch of different things, it's great. But if you're also are able to think outside of the box and have a familiarity with lasers and can kind of stretch beyond the apps, it really even opens up the capabilities of this device further, man. Maybe you could expand on that a little bit.
Yeah, I mean, I think they set, whenever you're able to specifically treat things, safely treat things, you're going to get a better result, right? And so, the skin apps are layering specific sort of treatments and giving you sort of a framework for which you can build upon. As sort of I was talking through with the refresh treatment and the define treatment, you can certainly kind of mix and meld them together safely. The refresh treatment doesn't mean you can't add erbium to it. It's just a matter of understanding, or they do a refresh to begin and then you do more of a defined treatment later. They play well on each other, and so it sets a specific framework, which allows us to really get people started. But once you're comfortable with it, and once you start to use this very powerful device, you're able to really get more out of it. So, sometimes, a device is sort of a one-trick pony. RF microneedling is a great example. It's a wonderful device, low downtime device, but all it's going to do is some texture, right? This is not a one-trick pony. You have pigment, vascular, and you've got texture. So you can really more completely treat patients, and get them a better result. And as you said, I mean, you're not bringing, sometimes for my patients, we'll fill a room with lasers. I mean, literally have 6 devices in there, all humming, all making noise, all heating the room up. And patients look at me like, are you serious? Are you really going to use all of those things on me right now? And I'm like, yeah, it's fine. You'll be all right. It does make them a little more comfortable when it's a one device. We're going to use the chrome. We're going to do the refresh treatment, and you are effectively using multiple things, but you're not overwhelming people and your staff with multiple different devices all at the same time.
Yeah, that's a good point. Yeah, it can be very imposing. One of my rooms in my Long Island office has like 1 million devices in it. There's like 2 cool sculpting machines. I have the Modus, I have the Chrome, I have the icon in there. And it's, when patients walk into the room, they're like, oh boy, like
Yeah.
they want to walk out sometimes. Yeah.
I mean, you and I probably have a point of pride with that, right? Like,
Yeah.
look at these things that I can do, and this is what I have. But when you flip it on the other end to a patient who's brand new to lasers, and this is their first sort of foray into it, that can be very intimidating. Especially when you walk a general dermatology skin check into that room.
Yeah.
They're like, what's going on? Are you derm or are you cosmetic? So it's nice, and it's a sleek looking thing too. It's a pretty tool.
Yeah, it really is. And the interface is great. The touchscreen
Yep.
interface, I think, is really, really cool. Very easy to use. So I'm sure after this titillating conversation, folks are going to want to learn much more about the Chrome device. And it's easy to do that. You go to cartessaaesthetics.com and there'll be tons of information on there. There's also a question and answer portal. So if you have any specific questions about using this device, about how to incorporate it into your practice, even like business related ROI type questions, you can click on the link and submit your question, and someone will get back to you with a very specific answer ASAP. All right. Well, a big thanks to Dr. Tom Griffin. The guy knows a lot about lasers, obviously. And thank you so much for sharing your knowledge with us and your experience with the Chrome device. I certainly learned a lot, man. I appreciate it.
Absolutely. It's been great to talk with you. Thank you very much, Cartessa, and everybody, for letting me talk lasers. It's one of my favorite things to do. So hope to talk soon.